Hi, I'm Dr. Wayne Collins from South Lake Medical Center in Pasadena, California. Today we're going to talk about our very unique program for frozen shoulder. Now, we see frozen shoulders from all over the state, all over the western United States, even out of state, and we do very, very well with them. And the reason for that is that we've developed this very, very unique protocol. Now, a frozen shoulder is defined as a shoulder where the shoulder joint itself doesn't move. It'll lock like that, it'll lock here, can't go over their head, that kind of thing. It's very, very painful, causes all kinds of problems. People can't sleep from it. It's just awful. And over a period of time, if it's not corrected, it'll get worse. Now, part of the reason that frozen shoulder treatment is not successful is, in my view, it's done incorrectly. Most of the time, a frozen shoulder problem is not an orthopedically frozen shoulder, rather it's a neurologically based frozen shoulder. Now, let me talk to you about that and let me explain to you a little bit about that. Now, here would be a muscle, okay? In the center of the muscle, there's a cell called a spindle cell that controls the tone of the muscle. At the polar ends of each muscle, right where the ligaments attached to the tendons attached to the bone, there's what we call the Golgi tendon apparatus, and that sets the tone or length of the muscle. What we're finding is in people who have frozen shoulders, this mechanism has gotten screwed up and it doesn't work correctly, so therefore your brain and your cerebellum, in particular in your brain, cannot coordinate normal body movements, and therefore the shoulder, the muscle becomes frozen. So, the joint becomes frozen. Let me talk to you a little bit about exactly how this works. Okay? Now, if you decide you want to make a movement, this is what happens. Okay? As we look at your brain right here, there is a pathway right here. It's called area 4 in your cortex of your brain. That's what we call the primary motor output pathway. So let's say you decide you want to move your arm, okay? You stimulate a nerve root. The nerve root comes down, goes down through a tract in your spinal cord. We go like this. Here's your spinal cord. It's called the cortical spinal tract right here. Over there, once it gets to that point, it communicates in your ventral horn cell of your spine to a motor output nuclei. It's right here. Now, in order to move a joint, it's a disynaptic pathway, meaning that there's two nerve endings that fire off in order to move a joint. If I'm going to take my elbow as an example and flex it, there has to be a nerve ending that's going to tell my bicep to contract and my bicep to relax. Now, this is the mechanism that gets kind of screwed up and it limits motion. They don't fire off normally because of trauma and whatever. So therefore, the nerve root that either goes to the bicep muscle to make it contract, or the nerve ending that goes to the tricep muscle, as an example, to make it relax, either one of them doesn't work. The end result is you get this abnormal motion. So what we've been able to do is we've been able to design a treatment protocol that works extremely well to correct this. So let me show you some of the other treatments that are going to be involved with this.